Ever wondered what deep vein thrombosis is and why it matters? Deep vein thrombosis, often shortened to DVT, is a serious medical condition. Picture this: a blood clot forming deep within your vein, usually in the lower limb. This isn't a superficial clot that you can see or touch, but a hidden threat lurking in the depth of your vascular system. It's not just a clot that we're concerned about, it's the potential for this clot to travel. Imagine a rogue agent, a fragment of this clot, breaking free and journeying through your bloodstream, its destination, the lungs, where it can cause a blockage, a condition known as pulmonary embolism. This is why understanding DVT is crucial. It's not an isolated issue, but rather it's the first domino in a chain of potential life-threatening complications. Now that we know what deep vein thrombosis is, let's delve into its symptoms. Scene script. How can we recognize deep vein thrombosis? Let's discuss the 5 key symptoms. Firstly, one of the most common signs of deep vein thrombosis is swelling in one or both legs. This abnormal swelling often occurs without any obvious cause and can be a telltale sign of a blood clot. The second symptom is pain or tenderness in a leg, particularly when standing or walking. The discomfort can range from a mild ache to severe pain, much like a muscle cramp, and it's often concentrated in the calf or thigh. Thirdly, you may experience a warm sensation in the affected area. This can occur due to the increased blood flow and inflammation caused by the clot, making the skin feel unusually warm to the touch. The fourth symptom is red or discolored skin on the leg. This can be a result of the blood clot blocking the flow of blood, leading to changes in skin color. The skin may appear reddish or bluish depending on the extent of the clot. Finally, veins visible on the surface of the skin, also known as superficial thrombophlebitis, can be an indication of deep vein thrombosis. This condition presents as inflamed and visible veins, usually in the leg. Remember, these symptoms can vary in intensity, and it's possible to have deep vein thrombosis without any noticeable symptoms at all. Knowing these symptoms is crucial, but understanding the causes can help prevent this condition. What are the root causes of deep vein thrombosis? This is a question that has puzzled and intrigued medical professionals for years. While there's no single answer, several risk factors have been identified. Today, we'll delve into the 5 most common causes. Firstly, prolonged bed rest or immobility often leads to deep vein thrombosis. When the body is in a stationary position for an extended period, blood flow in the legs can decrease, leading to clot formation. This is why DVT is a common concern for individuals confined to bed or those who travel long distances without moving. Secondly, deep vein thrombosis can be a result of inherited blood clotting disorders. This is when your blood clots more easily than most people's. It doesn't guarantee you'll develop DVT, but it significantly increases your chances. Thirdly, injury or surgery can cause DVT. These events can increase the clotting factors in your blood, which can lead to clot formation, especially in the deep veins of the legs. Fourthly, pregnancy is a risk factor. The increased pressure in the veins in a woman's pelvis and legs causes clots to form more easily. The risk of clot formation continues up to 6 weeks after giving birth. Lastly, certain types of cancer can increase substances in your blood that cause your blood to clot. Some forms of treatment can also increase the risk of blood clots. Remember, these are not the only causes, but they are the most common. With the causes in mind, let's consider the potential complications of deep vein thrombosis. What can happen if deep vein thrombosis is left untreated, you might ask? Well, let's delve into the 5 main complications that can arise. First, there's pulmonary embolism. This is a serious condition where a blood clot breaks off and travels to the lungs, blocking blood flow. It can cause shortness of breath, chest pain, and even severe complications. Then we have post-thrombotic syndrome, a long-term problem where the clot interrupts blood flow in the affected area, causing pain, swelling, and skin discoloration. It can significantly impact a patient's quality of life. Next, we have phlegmasia caeruleus dolens, a rare but severe form of deep vein thrombosis. It's characterized by severe swelling and blue discoloration of the extremity. It's a medical emergency that requires immediate treatment. The fourth complication is venous ulcers, open sores that can develop on the skin when the blood clot disrupts blood flow. These can be tough to heal and can cause considerable discomfort. Lastly, there's chronic thromboembolic pulmonary hypertension. This is a type of high blood pressure that can occur in the lungs' arteries due to leftover clots. This can lead to shortness of breath, fatigue, and eventually heart failure. These complications are severe. painting a stark picture of why it's so necessary to address deep vein thrombosis promptly. But remember, these complications are severe, but there are ways to prevent deep vein thrombosis. We'll explore these preventative measures next. How can we prevent deep vein thrombosis? This is a question that we can answer by focusing on 5 main prevention methods. Firstly, regular exercise is key. Physical activity keeps your blood flowing smoothly, reducing the chances of clot formation. Activities such as walking, cycling, swimming, or even just moving around every hour can help. Secondly, maintaining a healthy weight is crucial. Excess weight puts extra pressure on your veins and can lead to the formation of blood clots. By eating a balanced diet and engaging in regular physical activity, you can maintain a healthy weight and minimize your risk. Thirdly, avoiding sitting for long periods is important. When you're stationary, your blood doesn't flow as well. If you're on a long flight or car ride, try to stand up and move around every couple of hours. Even flexing and pointing your feet can help keep your blood moving. The fourth method is wearing compression stockings if you're at risk. These stockings are specially designed to apply pressure to your lower legs, helping to maintain blood flow and reduce swelling and discomfort. Lastly, follow your doctor's recommendations, especially if you're at a higher risk of developing deep vein thrombosis. This may include taking prescribed medications or undergoing certain procedures to prevent blood clots. Remember, prevention is your first line of defense against deep vein thrombosis. Prevention is the first step, but what happens if you already have deep vein thrombosis? What are the treatment options for deep vein thrombosis? This is a critical question that medical practitioners often face. Let's delve into the 5 main treatments. First up, anticoagulant medications, commonly known as blood thinners. These medications are the standard treatment for deep vein thrombosis. They work by decreasing the blood's ability to clot, preventing existing clots from getting larger, and stopping new ones from forming. It's essential to take these medications exactly as prescribed, as misuse can lead to complications. Next, we have thrombolytic therapy. This treatment involves the use of drugs to dissolve blood clots. It's typically used for larger, more severe clots or in situations where other treatments are not effective. However, it carries a higher risk of bleeding and is therefore not suitable for everyone. Thirdly, vena cava filters. These are small devices implanted into the vena cava, the body's largest vein, to catch blood clots before they reach the lungs. These filters are often used when anticoagulant medications cannot be taken or have proven ineffective. Then there are compression stockings. These specially designed stockings apply pressure to your lower legs, helping to maintain blood flow and reduce swelling and discomfort. They are often used in conjunction with other treatments to manage symptoms and prevent further complications. In severe cases, a procedure called a thrombectomy may be necessary. This surgical procedure removes a blood clot from a vein or artery. It's typically reserved for life-threatening situations or when other treatments have failed. Remember, early detection is key to successfully treating deep vein thrombosis. It's crucial to recognize the symptoms and seek medical attention promptly. Equally important is adhering to the treatment plan outlined by your doctor. This will likely involve regular follow-ups and possibly lifestyle changes to manage the condition effectively. Deep vein thrombosis is a serious condition, but with awareness and proper care, it can be managed effectively. Let's all strive for a better understanding of this condition to ensure the best possible patient outcomes.